This is a video to assess femoral attachment integrity in the cases of ACL rupture that we're using for the classification system. So I'll start with first a case where the femoral attachment of the ACL is nicely intact. Here we see the rupture zone, which is in the upper segment of the ACL, but the femoral footprint of the ACL still remains attached. And we can confirm that on the axial images with the femoral insertion of the ACL and the tear seen distal to the femoral insertion of the ACL. So this is a case of a intact femoral footprint of the ACL. I'll now move across to a partial avulsion of the ACL. So here we see the ACL rupture, but we also see a fluid signal intensity cleft heading up from this rupture zone towards the femoral footprint of the ACL. And this is best confirmed on the axial images where it shows the rupture zone here. And as you come proximally, you can see a cleft that heads up into the femoral footprint of the ACL, deeming this a type 2 injury as opposed to the previous case, which was a type 1 injury. And lastly, you'll go to a case of a type 3 injury, whereby there is complete detachment of the ACL from its femoral attachment with a clear fluid signal intensity cleft seen across all slices at the femoral footprint of the ACL. And this happens to be a pediatric patient with no bony avulsions seen on CT, which was performed immediately prior to this MRI. This is going to be a quick video on assessing displacement of ACL tissue in cases of ACL rupture for the purposes of the classification system. So here is the first case, which is that of a non-displaced ACL rupture. So you can see on these sagittal images there is an upper segment ACL rupture with minimal gap between the two ends of the ACL. And as we scroll on these sagittal images, there is no displaced tissue external to the intercondylar notch seen on the sagittal sequences, but also on the coronal sequences from the femoral footprint of the ACL coming all the way forwards to the tibial footprint of the ACL. There is no ACL tissue external to the intercondylar notch, deeming this a non-displaced injury, as opposed to this case where you can see clearly that this represents displaced ACL tissue from the tibial sided fibers of the ACL beneath the lateral femoral condyle and superior to the anterior root attachment of the lateral meniscus. And this is it here on these sagittal sequences as the displaced tissue. And here is the ACL injury. So a case of a displaced ACL rupture versus that of a non-displaced ACL rupture. This is a video to demonstrate how we actually measure the gap distances on the acute ACL injuries, and also how we're determining ratio of the gap distance to the length of the ACL. So here is a fairly tall 15-year-old adolescent who's 185 centimeters tall. And we can see a ruptured ACL in the mid-segment of the ACL with a significant detensioning of this ACL. On the coronal images, you'll also notice that there is what we call the empty notch sign. So as we scroll from anterior to posterior, you can see the tibial sided fibers here. You get to a point where this is the most posterior aspect of the tibial sided fibers, and in this space here we have what we call the empty notch sign, which is debris, and one click further posteriorly you start to see the fibers attached to the femoral footprint of the ACL. So on the sagittal sequences now, you get the best representative sagittal sequence for the line of the ACL. Here are the tibial-sided fibres of the ACL, and these are the femoral-sided fibres of the ACL. You try and use the proton density as opposed to the proton density fat-sat images, and you look for the most distal end of the stump of the tibial side as well as the femoral side. And what we generally go by is the black to black. So black being native ACL fibres and a native ACL fibre on the other end, also with its rather dark appearing configuration. And you want to try and measure the gap distance as being the largest gap that you can get between the two ends of the ACL across multiple sagittal slices. So this was the most largest gap that we could get on this ACL, and it's determined at 8.5 millimeters, with the length of the ACL at approximately 39 millimeters from the femoral footprint to the tibial footprint of the ACL, giving a gap distance ratio of 22% on this child. This is an acute MRI post-ACL rupture demonstrating significant detensioning of the ACL. Here on the sagittal sequences, you can see the tibial-sided fibres of the ACL demonstrating a fairly horizontal configuration, a fair way away from Blumenstadt's line, consistent with a significantly detensioned ACL. The ACL in this case also happens to have a significant gap between the two ends of the ACL, but the purpose of this video is to show you the classic appearance of detention tissue.